Hello, everyone. I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And in this segment, I'm going to be going over a very timely topic known as the addictions. This is the addiction test, trying to look for any sort of um, substance use disorder that is taking place in terms of alcohol, drugs, or even other behaviors. There's a screening tool here that you're asked in the first segment, and depending on what you answer, then you move on to the next questionnaire. So there's this goes into, as you can see, it goes all the way from nicotine to marijuana, alcohol, benzos like Valium, cocaine, fentanyl, heroin, prescription opioids, stimulants, and other. This, just for some technical overview of this, this is something that combines three questionnaires designed to access different types of addiction. So one of them was published in the Journal of American Medical Association, and that's known as the SUSC Substance Use Symptom Checklist. And these are fairly new because this wasn't something that was available like 10 or 5, 10 years ago. And then there's another one that's known as the Behavioral Addiction Symptom Checklist. Anyway, so I'm not going to bore you with the details here. But depending on what you select, so if I were to select fentanyl, which is very dangerous, this is something that has caused a lot of deaths, and heroin. People that typically have been taking pain medications that are prescription strength. When that was going away, then they were resorting to heroin and fentanyl, and there's higher levels of mortality for using these. So I'm just going to use fentanyl, and then take a look at next. And so here we go. In the past 12 months, did you have strong desires or cravings for this drug? So is this an incidence of using it once, or is it habitual? Did you want to cut back or stop using the drug but couldn't? So this is kind of like cage for alcohol use. Cut down, annoyed, guilty, all of these things. So this is converted to drugs, and I've actually used this the cage questionnaire in a recent study that I was conducting with collaborators. So, did you spend a lot of time trying to get the drug, using the drug, or recovering from using it? And then, did you have times when you used the drug more or for longer than you wanted to? So, I'm not going to go over the details again. This first part is in the last year. The second part is in the last 3 months. So again, the time ranges especially are a matter. Um, so again, it goes into some 3 months, and then since these are gateway drugs, they look at other different types of drugs that might have been used afterwards. So these are some interesting ones: ketamine, psilocybin, some of the psychedelics, and then the ecstasy, Molly, or MDMA. MDMA is very dangerous. Inhalants, glue, cleaning fluid, gasoline, paint, and so on. So there was, just to give you an anecdote, when I was studying global health in India, some of the slums, people would collect the whiteout and would huff it afterward. So this would take away some of the appetite, unfulfilled appetite that they were feeling from huffing the whiteout. Anyway, so these are concerns and there's considerations that need to be taken in order to address any sort of substance use that you may be facing. So I hope all this has made some sense. Thank you for listening.